Welcome to the About Sex podcast. I'm your host, Angela Skirtu, and you can find me at www.therapistintstlouis.com or at this podcast, www.aboutsexpodcast.com. Today I have with me Dawn, and Dawn is here to talk to us about what's going on with the COVID crisis or the pandemic. Hey, Dawn.
Hi, how are you?
I'm fine. How are you?
Not too bad.
All right. Well, so why don't you tell us a little bit about what you do in terms of this pandemic?
So I work in marketing and communications for a healthcare provider, and I also work as our public information officer on our incident command team. And the incident command team oversees all of the activities that we have going on right now with COVID-19.
Okay. Well, part of the reason I'm doing this episode is a lot of people we're definitely feeling the impact of the COVID-19 pandemic. And so I'm wanting to connect with people in the community who are working with hospitals to find out a little more about what's going on, what we can do as a community to help. So I guess my first question is, what's going on from your side of things?
From our side of things, it's just a lot of fear and people just not sure what to do and what's safe and what's not safe. And it's a very quickly changing situation. And it seems like something will be reported that it's okay one day, and then the next day things have changed and that's not safe anymore. So we're seeing, especially with healthcare workers, a lot of uncertainty, a lot of fear in doing a job that they've been confident in doing for a very long time. They've worked with sick patients with a lot of different communicable diseases and infectious diseases. And now all of a sudden there's this thing that just no one really knows anything about. So stress levels are very high, tension is very high, emotions are very high. And I think it's going to be this way for a little while.
What are some of the things that you're seeing that are changing? Like you mentioned that something that would be normal one day will be changed or different another day. So like, what's an example of maybe like a protocol that changes?
For example, one of the things that most of the healthcare providers are dealing with is restricting visitors. So for example, you have some hospitals that are no longer even allowing a birthing partner in when a patient is giving birth, just because they're trying to keep that risk of infection transfer down low. So where before you may have had a spouse or a partner in labor and delivery to help, take care of that newborn and help with that patient. And in some places that's not available anymore. You have patients who may be end of life and their nurses are there by their side and they can't have family members with them. And nurses are allowing families to FaceTime in and just trying to do everything they can to have these loved ones connected to these very sick or dying patients. And it's just completely different. It's just not how healthcare has ever been practiced before.
What is that one of the only ones, or are there other changes that we're seeing?
Another change is, just with the personal protective equipment, we know we have a shortage nationwide. We've seen the other countries have these shortages and it's been devastating. And so it's that finding that balance where before no one thought anything about picking up a mask and putting it on to walk into a room and then throwing it in the trash can when they walked out. And now it's, what equipment do we have available today? And is it going to be there tomorrow? And one day you may be able to wear certain equipment to go into a room, and then the CDC sends different recommendations down the next day and says, no, now you have to do something different. And that's really scary for the staff because they want to be able to do everything they can to protect themselves at all time. But then at the same time, if you use up everything you have today, if 2 weeks from now we have 10 times as many patients and now you don't have any equipment, protective equipment left, then what do you do?
What are you guys short on right now, or what are you seeing the country being short on in terms of protective equipment?
One of the big things is the N95 masks. And what that is it's just a mask that fits very tightly over the face, that's disposable, that really protects against those droplets that are in the air, which is how this can be transferred. And there is a shortage of those nationwide. I'm not familiar. I shouldn't say not familiar. In the St. Louis area, I don't know that we're at a point yet where ventilators are a problem like they are in places like New York. But I fear at the rate Missouri is going, we could very quickly be in that situation where we're going to have healthcare providers having to make a decision as to which patient gets the ventilator and which patient is basically just left to try to do the best they can on their own. So those are probably two of the biggest things. I mean, but it's everything. It's gowns, it's gloves, it's the isolation masks. Healthcare providers going to allowing their employees to wear homemade masks that have been brought in by the public is just something that's never been heard of in modern medicine. And that's what it's come to.
I've actually heard that from, I have friends in the community and nurse friends, and one of my nurse friends mentioned that in like a small rural town in Missouri, they're considering like having people make those homemade masks since they're not sure they're going to have enough, but the homemade masks that they can take home and wash, which, yeah, like you said, it's not something you're expecting essentially in
Right.
a
Yeah.
hospital.
Yeah. And it's definitely come to that. I mean, it, what a lot of the large healthcare organizations in around St. Louis are saying now is if you're not a frontline worker where you're working directly with these extremely high risk patients, and you want a mask all the time, then the homemade mask is the way to go. And it's your responsibility to take it home and wash it at the end of the day and bring it back. And so that's just never been seen before in these days of medicine.
Are you seeing situations where, like, so one of the things that I was curious about is masks at home. Like, I'm seeing people wear masks, going into grocery stores, or what is the situation right now about whether people should be wearing masks at home or going out to grocery stores, for example?
If someone has, a high risk, let's say they're immunocompromised or they, are a former cancer patient or have something like that where their immune system, autoimmune disease, what that mask primarily does is it's protecting you from spreading germs outside. So yeah, those people that are high risk, maybe they want to wear a mask. Ideally, they would not be going out, period. But I know not everyone can do that. I think that there's a lot of misinformation where people think wearing a mask is keeping them safe. And what they don't realize is masks are designed to be thrown away after you wear them. Or if you're doing the homemade mask, it should go immediately into the wash. And what you're seeing is people going into the grocery store wearing a mask, and then they're wearing the same mask the next day and the next day and the next day. And so any germs that they're picking up, any of the virus would just be sitting on that mask. It can live on various surfaces up to, they're thinking, 4 to 5 days. So just depending on the surface. So it's not necessarily beneficial. The best thing to do is stay home, not go anywhere unless you have to. Practice the hand hygiene. Don't touch your face. That is another flip side to the masks, is a lot of times if you have the mask on your face, you're going to be less likely to rub your nose or rub your mouth. So it can help with keeping your hands off your face. But as far as just the general public wearing masks, that's really not going to be the solution to this problem.
Well, and that's why we're doing all of this social distancing right now, is that really we need to stay away from each other until we've headed off the curve, so to speak. That's why everybody's doing this social distancing. Are you seeing a lot of COVID-19 patients, or are your hospitals seeing a lot of COVID-19 patients yet?
Definitely. Considering the number that there are in the state, we have seen quite a few. And it's, we're to the point where initially what we were seeing was travel related. And now we're at that point where it's community spread. So it's no longer just if you travel to those places where you're high risk, it's everywhere. We're definitely seeing patients that are testing positive that they have no idea how in the world they contracted it. They haven't been anywhere. They haven't been around anyone that they know is positive, which tells us that it is out in the community. And that's why it's so critical for people to truly take social distancing seriously and to understand that that doesn't mean sitting in a parking lot in the back of your minivan 6 feet away from another minivan chit-chatting with other people. This means staying home unless you absolutely positively have to leave your house.
So when we talk about social distancing, what are some of the guidelines that people should be trying to follow? Like, because I think, to your point, not everybody knows even how to take it seriously or what it means. And I know that we're very social people, so people want to be around others. So, like, what would be ideal guidelines for social distancing um, right now?
So ideally, it would be, as I said, you're not leaving your house unless you have to do one of those essential activities. And what would be essential would be grocery store, an urgent medical appointment. Um, if you're checking on elderly relatives that maybe need help with care, or if you work in one of those essential fields where you just can't not go to work, that's your healthcare, that's your grocery stores, your gas stations. If everyone else could really just hunker down and stay home and use the technology that we have, um, such as FaceTime and Zoom, and just stay away from anyone that doesn't live in your home. And that's kind of where I think a lot of people are thinking. The initial recommendation for social distancing is no groups larger than 10, and that you want to stay 6 feet apart from each other. And that would be kind of the um, minimum. And what a lot of people don't understand is when they say no groups larger than 10 and staying 6 feet away from each other, that should be only in those essential situations. So that's not getting a group together in the driveway and spreading your lawn chair 6 feet apart to sit around and talk and have a drink and hang out. That's not essential. That means when you go to the grocery store, you don't get within 6 feet of another person if at all possible. That means if you're in the grocery store and there's a large group of people, you want to move further away from them until it thins out so that you can move back over into that area. So I think it hasn't been clear. And so a lot of people are really taking a lot of liberties with what social distancing means. And that's why we're continuing to see these numbers just multiply over and over.
I gotcha. Well, and I want to add something. I was actually reading this article from New Zealand. New Zealand was able to do a big mass testing of their population. And what they found is 50% of the people they tested that tested positive for COVID-19 did not show symptoms.
Exactly.
And so I think it keeps changing. And I think because of that, people are not very aware of all the things that they should be doing to keep up with those changing. So you're talking about these rapid changes in the hospitals, but I even think people are seeing rapid changes. So initially it was 6 feet away from each other, only going out as essential. But before that, it was okay, well, you can go out, but to grocery stores and to this. And so I think all of us are trying to keep up with this rapidly changing situation. And I just don't think people are aware of all the ways that they need to make those changes. And because the symptoms in some people, like in New Zealand, 50% didn't show symptoms, that essentially means these people are carriers and they're able to pass it along. Even though they're not getting sick from it, they can still make other people sick. So that was one of them too, that they were saying, well, if somebody's showing symptoms, go, stay at home. But I think what people need to understand is even if you're not showing symptoms, you could still pass this along.
Absolutely. And I think that's why we have to look at what has happened in these other countries, and the countries where they have gotten control of the situation, and then the countries where they had devastating loss, like in Italy, that we need to learn from them. What they're saying is we should have done weeks ago what you need to do as a country now. But I think there's a lot of that mindset of it won't happen to me. And
Yeah.
like you said, there's a lot of people that are carrying this and they don't even realize it. And they're fortunate that they're not having the symptoms, but at the same time, it can't just be about you. This is one of those times where we really have to look out for each other and look at protecting society as a whole. And it's just not a time to be selfish because a lot of people are going to lose their lives. And we do have the ability to get a hold of this and get some control. And it's just a matter of being self-disciplined enough and selfless enough to say, okay, I can give up a lot of these extra things for a few weeks to make sure that I'm keeping people safe.
hmm So I want to turn a little bit to some of this testing, since you're kind of in the supply and demand area. I'm curious, why aren't more people being tested?
A couple of reasons. One of the big reasons is, again, supply shortage.
Mhm.
The testing, this is a new virus. So it's not something where it's not like influenza where they had a lot of tests just sitting around waiting to be used. And they kind of have a predictor every year of how many cases they're going to have. So they know how many tests to make. It's new. And so it was kind of we have to hurry up and try to get tests as quickly as we can. It also comes back to kind of what you were saying is a lot of people can be carrying it and not have symptoms. So testing everyone is virtually impossible, especially for something that's new. We just don't have the supplies for it. Um, so what they're trying to do is it's a process of elimination. So if someone presents with symptoms, they start with strep and influenza testing, and if they test positive for strep or influenza, then that's where it stops. As long as their symptoms don't worsen, they're going to treat for strep or influenza, whichever one they test positive for. If they test negative for strep or influenza, that's when they'll start looking at how symptomatic are they. And what they're recommending, if they're not extremely ill, is go home, self quarantine for 14 days. If you get worse, call us back. Um, I actually do know someone who had that happen, tested negative for strep, negative for influenza. No, we're not in a position to test you for COVID right now. Go home quarantine. They did. About 4 days later, they got worse. They went in, they got tested, they were positive. So fortunately, they were already quarantining. But I think this comes back to that mindset that everyone just needs to act like they have this and stay home. And that's really the best thing we can do because we don't have the testing available to test everyone. And even if you don't have it now, if they did test everyone, if you don't have it now, that doesn't mean that you couldn't pick it up by going out and doing things in public, because there's someone else that may have it out there that is spreading it and doesn't realize it.
Yeah, I could see somebody getting a negative test result, feeling like that's kind of like, all right, I'm good. I don't have to go. I don't have to worry about this. I'm safe. But
Right.
it's like it doesn't mean that you can't still get it later.
Absolutely. Absolutely. And that's what's frightening is they don't know if people that are recovering from this, they're hoping that they'll have antibodies and they can't get it again. But we don't really know. It's too new.
Yeah, we don't. I've read some of that in other countries that we're not still sure that you can't get reinfected by the virus, and so that's a part
Yes.
of this too. Is that yeah, you may get it, but we don't know that you're actually getting better. You may just be have a lowered, compromised immune system now.
Right.
Uh,
Right.
and something else I actually had, to your point earlier about like that person. So some people aren't getting tested, but are showing the COVID-19 symptoms, but because there's not testing available, they're not being registered in the state as here's more of these positive cases. So something I was just speaking with a client about, and she was saying that it was in this group, like this company, and like five of the people in the company got it. It's a small company, right? So
Right.
then when everybody else got the symptoms, they said, don't bother getting tested because you have it, just go
Right.
quarantine. And so what people also aren't aware of is that there are quite a few people who probably have it, but who aren't being registered with the state for that reason. Like that was a whole company of people essentially, and only five of them got the positive test that was registered with the state. And so there's a lot more people impacted by this than we're even seeing in the news for cases like that.
Right. Yeah. And until we get to a point where we have more testing available, we just aren't going to know. And and they have to preserve those tests. I know there's a lot of people that I've seen, especially on social media. A lot of people are angry because healthcare workers that are presenting with symptoms typically can get tested, and they're like, "What makes healthcare workers special? Why do they get tested?"
Because they're working with them.
They're working. And if you have symptoms and you test positive, then we have to furlough you so that you're not infecting other people. But if you have symptoms and we test you and you have influenza, you can take Tamiflu, and as soon as your fever's down, you can be masked and come back to work. So there is a lot of that. I've seen a lot of anger in not understanding why healthcare workers can get tested. But one, there is a higher exposure, and two, if we have a large number of healthcare workers who fall sick, we're in trouble because then who's left to take care of the people that come in?
Yeah, absolutely. I mean, like that's something that I think people aren't really thinking about is that, healthcare workers are they're the first responders essentially in this
Yes.
situation. And so if we're not taking care of our first responders, then, this whole modern medicine that's supposed to help us won't be there.
Exactly, exactly. I keep telling myself this is why they call it practicing medicine, because there's just we take for granted because we have come so far with modern medicine. I think we take for granted sometimes that there's a lot of stuff out there that we just don't know. And that it's we're still learning, and this is a perfect example of that. It just hasn't happened in a very long time on this large of a scale.
Hmm. Well, and I think that's probably part of this is that we've kind of gotten into a little bubble, like we've felt like the last time we had a pandemic was over 100 years ago is the
Right?
Spanish flu.
Spanish,
And
yes.
so I think people, because we haven't had something like this in a really long time in many people's lifetimes, I think people have just gotten comfortable in a bubble like, we're okay, nothing's going to happen, we've got doctors, it's fine. But like, this is, I mean, to be fair, I had another client say this to me, but they basically said, we've kind of had a long time coming for a pandemic. It's really common in history for this to occur.
Absolutely. Well, and I think we get very complacent. Nobody wants to get influenza. Influenza's terrible. It's miserable. But if you get influenza and you catch it early, you can get antivirals in a couple days. You start feeling better, or you can get a vaccine, and then if you get influenza, it typically doesn't last as long. If you get strep, we know it's out there. We know it's contagious. You take some antibiotics and you feel better. And I think we get complacent. And I think this is one of what happens from getting complacent is then you have something like this, and we're all used to just going about our business. And I told my husband, I feel like I'm in like a scary movie, except you can't see the monster that's outside. And so you're hiding in your house and you're scared to go out because nobody can see the monster this time. And that makes it really terrifying.
Yeah, that makes a lot of sense. Well, and to be fair, I want to give people credit because the reality is it is hard to do this. I'm obviously quarantining as well, and I'm the kind of person. So I'm a therapist, so I've done a lot of face to face work, and it's very hard to go from like this was my life, and I used to go to work and do these things to suddenly now I'm at home. I've got my kid. I'm sort of homeschooling, but I'm not going to give myself a lot of credit for that because it's really hard. Like
Yes,
I'm
it is.
I'm just setting some basic goals like every day for like, okay, what can I accomplish today? And one of the basic goals is just make sure I shower every day and get ready so I still feel a sense of normalcy.
Yes.
Because I got to tell you, like, it's driving me nuts staying at home. And so, like, for people listening in, I do want to at least show some camaraderie here of like, you know what, it's okay that you're struggling to be at home a lot right now, especially if you're highly extroverted.
I agree. And I think that's where we can really take advantage of technology. And I know it's not the same as face to face, but like, for example, there's a group of like 15 of us girls that, we want a ladies' night and we can't do a regular ladies' night. So we're going to do a Zoom board game night. And we found like the game's categories. We found all the
Mhm.
categories online. So all you need is one person with the dice, one person with the timer. And this weekend, we're going to do a Zoom board game night and sit around at home and drink by ourselves and play games together. And I've really tried to, because this has been very difficult. You're right, it's really hard. My kids are a little bit older; they're high school age, which I think makes it easier. I God love all of them, with all of you with toddlers or elementary age kids. Because I know that's a whole different type of doing schoolwork than teenagers that are a little more independent. But what I've really tried to do, because this has been very difficult, and I've tried to get up every day and try to find one positive of the situation every day. What's one thing positive when I get up in the morning that I want to focus on for when things get really hard or really scary today? Um, and I've really tried to do that every day and then keep that kind of at the top of my mind to fall back on that when things do get stressful and scary and hard. I've got a couple other girlfriends that each morning when we get up, we will do a one word check in, and we will send one word that kind of describes how we are that day. And if we want to elaborate on it, we can. And if we don't, we don't. But it's just kind of letting somebody else know where you are. You're checking in with someone, you're checking in on your friends that way. Um, and so just, I think little things like that can really just kind of help keep you a little bit I wouldn't want to say calm because I don't know if that's the right
I
word.
think it's okay to be a little insane right now. Like
Yeah,
I've been playing with my clients and saying stay safe or stay healthy and sane, but then I say ish at the end because the reality is
right.
like it's okay if you're feeling a little insane right now. I think we all are.
Absolutely. Absolutely. Yeah, it's just a crazy time, and it's so unique in that nobody really knows what to do. All these, whether it's government officials or our healthcare system, where we've always kind of had someone to lean on. um Nobody knows what's going on right now, and so insane is a really
Yeah.
good word to describe.
And I think normalizing that helps people too. Like, it's okay for you to feel a little insane right now. It's okay for you to be up, down, all around. Like, I think
Yes.
people need to feel a sense of like, it's normal to not feel normal. And how can you find, like you said, one small thing, one positive thing a day? I actually had my sister mention like one goal for yourself a day, just one goal, whatever it is. But I think like even giving yourself permission, like yesterday, I'll throw myself under the bus. I wasn't feeling any of it. I didn't care. I was just like, life sucks. This is horrible. And so
Yeah.
like I gave myself permission to just watch a comedian and not do anything. You know, like
And
I
I
think
think
you
that's
need to
so
do that.
important. I yesterday just must have been a day because I did not have a great day yesterday either. And
Mhm,
I'm working from home now. And
mhm.
so I'm very fortunate in that even though I work in healthcare, because I work in communications and marketing, I can do a lot of what I do at home. And so I was just having a really crappy day. And finally at like 1:30 in the afternoon, I was like, you know what? I'm going to go run a bath and I'm going to take a book and I'm going to go soak in the bathtub for 20 minutes. And I'm going to start this day over at 2 o'clock in the afternoon.
Oh, that's
And
cute.
I came out of the bathtub a completely different person. I think that sometimes we just get so overwhelmed. And especially in this situation, what I recognized is those self care things that I usually do are limited because
Mhm.
we're stuck at home. So I had to kind of really check in and be like, okay, what can you do to kind of get back to center and start over? And I mean, a normal work day, it's not okay to take a bath at 1:30 in the afternoon to calm yourself down. So I think it's a time to give yourself some grace, be
Uh-huh.
creative, and not be afraid to do the things that are abnormal and maybe seem a little bit weird because you have to do what you have to do right now.
You know what, Don, though? I think that's a really helpful thing to put out there too, because I've definitely been with my family and my friends talking to people about, what are you doing? And that's part of it is shaking up the routine in new ways. Like my own partner said he's working from home too, because everybody's either working from home or laid off. But like,
Right.
like it was lunchtime and he had a sandwich and he was like, you know what, I'm gonna watch Sons of Anarchy right now because I can. It's my lunch break. And like
Right.
he was saying he's doing more stuff during lunchtime, like he's exercising or like we're going out for a walk during that lunch break between like clients or work because you can. And so some of it is maybe looking at like what are new ways to do self-care, but even in the middle of the day, what are ways to have a routine but shake up what the old routine looked like because everything's kind of a new normal for people. But you know what?
Absolutely.
If it's a bath in the middle of the day or if it's a show or even a walk, like whatever you need, like I'm just giving permission. Everybody do it, except if it's not social distancing.
Right, exactly. As long as you're doing it by yourself or within the people in your house, you're good to go. Yeah.
Yeah, right, right. Well, so, since we are both linked to a bunch of people, what are you hearing from your friends and family that is helping them? Because I think people need that right now too. Like, what can you do when you're by yourself?
So like I know I'm fortunate in that my area that I live in is a little more rural, which I think makes social distancing a little bit easier. Because a lot of us can go out and go for a walk and we can walk 3 or 4 miles and we don't see other people because we're just a little bit more isolated in general where we live. So I've seen a lot of people who are, going for walks and taking their dogs for walks and just trying to get outside when the weather is nice.
Dogs are so
Um,
happy right now,
oh
I'm
my
telling you.
gosh. Oh my gosh. My cats are so angry and my dogs are so happy.
Your cats are like, "Aren't you gonna leave yet?"
Yes, exactly. Um, There's a lot of people around where I am at trying to just get outside and take advantage. And unfortunately, though, what I'm also seeing is a lot of people just completely ignoring the social distancing thing and going and doing all the things that they normally did anyway. Um, so
Okay.
yeah. Teenagers especially, it's really frustrating when you're an essential worker and you have to go into a more populated area and you see all these teenagers at the basketball courts playing basketball, and it's like, no, that's not what you're supposed to be doing right now. And I think
Oh, those rebel teens.
I know. A lot of my friends also, they're trying to use this as a time to reconnect as a family. I have
Mhm,
several friends who have kids that were college age that had to move out of their dorms and come home. And they feel
mhm,
like this is a little bit of a blessing in disguise because where they thought their kids had left the house and would probably never return, they've got them back at home again. And they're getting to spend some time with them where their kids are a little bit older and they're more adults and they don't require as much parenting and they're really just getting to be friends with their kids. And I think that that's something I've heard several of my friends talk about that I think is a pretty neat way to put a spin on a really hard situation, is just getting the opportunity to interact with their kids that way as friends instead of having to parent them. But yeah, most of the people around here, they're just trying to get outside when the weather permits. That's what I'm seeing a lot of.
One thing I wanted to add too, that I've heard some of my couples are taking what I'm calling driving dates, where you stay in the car, but because you feel this kind of antsiness, they drive. They just drive for a long time and then come back. And so like that's another way you can kind of stay in your car. You're not getting out to like talk to other people or anything, but like driving and just talking on a road trip to come back has been really helpful for some of my couples. And then
Yes.
I personally, it's funny. So I went shopping and I was like, I need things. Like I need things for my daughter. And so literally me and my friend, we did not talk before this, but we both bought bubbles for our daughters yesterday. And her husband had said to her, we're only supposed to buy things that we need. And she was like, this is an essential purchase. But
Absolutely. Whatever keeps
I
the kids happy.
I got to be honest, I felt like it was an essential purchase too. Like I'm still picking like a cheap something with bubbles, but like once I had those bubbles, Olivia she was just entertained for an hour. And I was like, no, you need bubbles. Everybody needs bubbles for the COVID-19 pandemic.
I think that when it comes to, I've heard a little bit about people talking about the essential purchases. And I mean, I get it. If your kid needs to draw and paint and sidewalk chalk because that's what keeps them happy and content, to me, that's essential. I think it's easy as adults to dismiss the fact that, well, kids don't understand what's going on. And kids' entire routines and lives have also been flipped upside down. So I say whatever helps
Absolutely.
them feel safe and secure and keeps them occupied and calm, go for
Mhm.
it. I mean,
Absolutely.
I think that when it comes to those kind of things, essential for me might be different than what's essential for you, but that doesn't make one or the other more or less important.
Well, if you think of what's going on for kids, my own daughter, she's an only child. And what she keeps saying to me is, where are the friends, mom? Where are the friends?
Oh,
I know, it's really sad actually, because like
yes.
that was a part of her routine. And I'm so grateful, honestly, for her school. They're doing this thing on Monday, Wednesdays, and Fridays where she can Zoom her kids, her fellow
Oh,
classmates,
that's great.
because she needs to connect to them. And like you said, we need to use the resources we have, and technology is a great resource. There was a Zoom meeting with the two teachers and like 20 kids just making funny faces and showing their toys. But like, yeah, whatever kids need, whatever teens need, whatever adults need right now is essential. And so if it's bubbles, it's bubbles. For teens, if it's, I guess, a video game, like a video game could be essential for a teen right now if their whole life is kind of crumbling, and
Yeah,
that's a way for them to connect.
that's how my kids are connecting with their friends. Since the day that schools shut down, my kids have been at home, and that's how they're connecting. They're playing their video games, and they get to talk to each other, and that's what's keeping them happy. So as long as they're getting their schoolwork done too, I'm like, if you want to stay up till 1 o'clock in the morning and play video games, as long as you get up in the morning and do your homework, have at it. Like it's kind of like the wild, wild west around here right now.
I can imagine that with a bunch of teens.
Yes.
Well, and I like that we're getting a different perspective here too, because I can definitely bring the 5-year-old perspective, but I don't have teens in my house. So it's like, what are teens doing? They're playing video games and talking to each other. But that's a part of video games is they can socialize online that way and actually feel
Yes.
connected to their friends. And of course, there's Facebook, but I have been telling everybody, all of my clients, like, don't just text each other, call each other, FaceTime each other, because I just don't think texting alone is doing enough for people to feel that social connection that they need during social distancing.
Yeah, I agree. There has to be more than just written word like that. I think, especially when if you're having a bad day, I think sometimes just getting to verbalize that in a way outside of writing it in a text message, I think it makes a big difference.
Well, so, John, one thing I just wanted to, I'm asking for the community, but what are things we as a community can do to help the hospitals right now? If there is anything that we can do, like I know social distancing is a part of that, but I'm also curious, like things the hospitals need from us so that we can contribute. Cause I think people also feel connected through purpose. So what are your thoughts on that?
So yeah, again, the social distancing, like you said, that's definitely the biggest thing that everyone can do. Some hospitals are taking food donations for staff. There's some hospitals that have programs set up with restaurants in the area where the restaurants are discounting meals, and you can call these restaurants directly, and maybe for $8 or $10 you can provide a meal to a frontline healthcare worker. Because a lot of healthcare workers, one, they're not getting time to step away to take a lunch, and
Yeah, they're doing 10 and
two,
12-hour shifts.
exactly. And then the cafeterias have to be limited because, again, we're trying to keep people from congregating and keep everyone safe. So providing meals is something. Of course, it does need to be prepared in a commercial kitchen and not. While it would be amazing if people wanted to make things at home and bring them, but they just can't accept that. What I recommend is every healthcare organization that is kind of in our area here in St. Louis. Um, we all have a point of contact set up where you can send an email and say, hey, what do you need? And they'll let you know whether it is sponsoring meals or donating the masks. Because, if you have a hospital that has 10,000 employees and they're going to tell their employees, well, if you have a homemade mask, you can wear one. That's a lot of masks. So that is a huge thing right now. Um, and just another one that's really important is just being patient and understanding. It is scary if someone does get sick or injured right now. We still have to be taking care of those people too. It's not like all other illness and injury has stopped for COVID-19. And so I think it's being patient and understanding that if you do have an illness or injury that requires you to get medical care and you can't have your family with you, whether it's in the emergency room or if you would happen to get admitted to a floor, while it is very frustrating and disheartening to not be angry at those healthcare workers because they really are doing the best they can. And the rules aren't to be mean, they're to try to keep everyone safe. And so I just think compassion goes a really long way in a time like this.
Okay. Do you have any links or resources to some of those places so that people could, if they like, for example, if they do want to donate to food, um, could you maybe leave that? If you do know some of that, then we can put it in the comment section in the podcast. But I'm curious if you actually know any links at this point.
So I'll have to get them for all the different organizations, and I can definitely send them over to you.
Okay, cool.
So that'd probably be the best thing to do. I know in the St. Louis area specifically, we've got four major healthcare organizations, and they're all collaborating and really trying to work together to help take care of each other. So I'll get all that together, and I can send all of that over to you.
All right. Any final, I don't know, words of hope or just things you'd want people who've been listening in to, final thoughts for people?
Um, my final thoughts are we're going to get through this. We're going to get through it together. It's a scary time. It's an unknown time. Um, I'm a big musical theater person. My family's all about music. And yesterday, one of the things that I saw when I was going through on social media was a song from the Broadway musical Dear Evan Hansen, and the cast all got together through Zoom and sang one of the songs, which is called You Will Be Found. And the song had kind of been on my mind anyway a lot through this, that, it's scary and it's hard and it's unknown, but we're all going to come out on the other side. Some of us are going to face loss and tragedy and hard times, and some of us won't be touched by this at all. But we're all in it together. It's not very often that this entire country and an entire world is unified for one cause, whether it's a positive or a negative cause. And so we're living through something that's very powerful and historical, and there's a lot to be learned from it. So we just have to hang in there and know that the day is going to come when we can open our doors and we can walk outside and we can hug our friends, and we're going to get there. And so just hang on and let history play out and do its thing.
Thank you so much, Dawn, for joining us. And just to add something to that, I actually had a client say to me today, um, maybe this is a time for us to pause and learn some new skills. And I think that's kind of similar to what you're saying, which is, okay, yeah, we can go crazy. We can feel like, the world's falling apart. Or we can take a pause and learn from this. And so
Absolutely. Yeah.
it sounds like that's what we need to do right now. Well, thank you so much again for joining me today. And this has been the About Sex podcast at www.aboutsexpodcast.com. You can also find me as a therapist at www.therapistintlouis.com. And thank you again for joining me, Dawn. Stay kinky, St. Louis.